As I did mention, we are continuing then with this discussion, and now with us on the line is Dr. Benita Nel from Childline in Mpumalanga. A very good afternoon to you, Doctor. Thank you so very much for joining us here on SABC News.
Good afternoon. Thank you for having me.
Just as a start, I mean, we were just having a conversation with one of your partners there from UNICEF, and one of the questions that I posed was about, how are organizations like yourselves able to identify, those families with children who are perhaps being abused? In your instance, you have perhaps children, in fact, calling in and reporting the abuse that they're experiencing, and I'd really like you to talk to us, please, about the kind of calls that your agents or counselors are receiving. And I'm also interested to know around the age of, the children that are calling, because I do imagine, as I said to our previous guest, that the younger children who perhaps might be a little bit more vulnerable won't be able to make those calls. And I wonder how Childline would be able to help even those.
What we find is that it's not only children that call in, but family members, brothers and sisters, next door neighbors, community members. So children and people who has got concerns about children call us. The age group that we mostly have calls from is between 13 to 18. Like you say, not the smaller children, more like young adults. And the type of calls that we've received over the COVID period was, firstly, a lot of poverty. There was a lot of requests for food parcels, and that is across board in all our provincial offices in South Africa. Then we've also seen high levels of anxiety amongst the children. Fear of, am I going to die? Am I going to lose my parents? Are we going to be okay? Can I go back to school? The type of questions that children is asking, and that they suffered with. Children was also very scared, especially children with parents in the healthcare sector. Would call and say, my mom is a nurse, and will she be okay? There was also concerns about people not using the prescribed COVID regulations, the social distancing, using masks and sanitizing, not complying in the community, and also children that they play with or children that they interact with. So I think high levels of anxiety, high level of need for food was observed by us. But then we have also seen an increase in sexual abuse and physical abuse. Interestingly, we found that the physical abuse sometimes was higher than the sexual abuse, but both did come to our doors, and we did had to deal with those kind of calls. And then during the lockdown period, many parents were concerned. Children were like in one province or in one area before lockdown, and then lockdown happened, and now they wanted to move the child back home, but couldn't because we were not allowed to move them around. And how we could assist them, going to the police, doing affidavits, getting support to get the child safely at home. Because the lockdown was for a lengthy period, it wasn't just a month as we expected in March, it went way beyond that. So families were really traumatized with that whole situation. Children were also very concerned about the unbanning of buying alcohol and what it would do to them. Many children called in and say, if my parents buy alcohol, will we have food to eat in the house? Are they going to beat us up? Is my mom and dad going to fight again? Is my grand going to use everything for alcohol? So it depends on the child's situation at home. Created the trauma or the fears that they called us, and counselors could help them deal with their emotions, help them find answers, help them remember safety tips for themselves, and also find closest support structure to them where they could access help. Alternatively, we could call the police and work in partnership with the Department of Social Development, where we could remove children and move them to family situations where they could be safer, or in children's home or place of safety for a period, just to make sure that everything at home would be safe for that child. Unfortunately, lockdown has also led to children's behavior changing. Out of fear, they start just going out and say, I'm going to live my life, I'm not going to be locked down by this. Children start acting out, aggressiveness. That is also reported by parents, and we could understand why, and we could guide parents to deal with the children's fear and understand the acting out behavior changes, the fear of not being able to complete matric and not being able to get their qualification. Some of the children that called our crisis line was repeating matric and saying, this is the second time now, how are we going to get through all of this? So we really had to build hope, build resilience, help them find something to hold on to and say, this will pass too. We will get to a stage where everything will return to as normal as we possibly could in the circumstances. So I think in short, that is some of the most prevalent cases that came to Childline in Mpumalanga.
Dr. Nel, I mean, you know, we've been hearing, and I think you also emphasized the point, the fact that COVID-19 actually made the situation worse for children in terms of abuse. When it comes to, I want you to just focus on physical abuse at this time. You did talk about the stress and anxiety of families, and I'm wondering if some of the stress and anxiety that maybe the parents were feeling is really resulted in them really taking out their anger, frustrations, and that stress and anxiety on the children. Was that something perhaps that you found? You know, there were a lot of parents, for instance, who might have lost work. A lot of situations, different situations, bad situations were happening, especially during the harder lockdowns. I mean, some were not able to, in fact, work because the places where they worked were maybe closed during the time of lockdown. I wonder, was there any sort of link that you might have picked up, Dr. Nel, to what I'm saying in terms of parental, you know, stress and anxiety and anger?
Yes, what we saw is it depends on households. The management of coping with the trauma and stress that's on them. Different triggers reacted or resulted in different behavior. Parents lost their job, some was retrenched, and their uncertainty of how am I going to access help from government, how am I going to qualify for payment from the funds that is being talked about on TV, and I'm not sure if I can. That created a lot of anxiety, and as food sources became less and less, you would see the anxiety increasing. Taking it out on the children wasn't just sometimes premeditated. I think it was spontaneous in the moment, and it's never to use violence. But also we've seen that triggers like children coming home very late, not listening, not complying to the rules of the household, caused parents to feel so totally paralyzed and not in control. And everything was not in control, that they're trying to use violence in a way of just bringing the child back to order, bringing some level of control back to the household. But don't think that it really succeeded in getting the children back into the family as they wanted to. Most of this, I think, is the loss of control, the uncertainty, not understanding where are we going to end up, and will my family be safe? Will we be able to continue surviving?
All right, Dr. Nel, a pleasure speaking to you, and thank you for the work that you're doing. Thanks indeed for being with us here on SABC News this afternoon.